All right, welcome back everybody to the PA Mastery Method. Here we are going through the PAEA topic list for family medicine. This is the EOR focused exam. It's the rapid review questions. These are all your first orders. This is going to be part one of many, so make sure you check them all out to test your active recall skills. What is the treatment for chlamydia? We're going to do doxycycline. What is the treatment for PID, pelvic inflammatory disease? This one we're going to do ceftriaxone, doxycycline, and metronidazole to give us good coverage, address maybe some BV, as well as gonorrhea and chlamydia. What condition does chylonychia present with? So we're going to see it with our iron deficiency anemias. That's going to be the spooning of the nails. What medications have a proven mortality benefit for heart failure? So I remember these as the BASH medications, which stands for your beta blockers, your ACE inhibitors / ARBs, your spironolactone, and then hydralazine with nitrates. What is the best treatment for a posterior nosebleed? So remember, posteriors are more at Kesselbach's plexus. They are further deep in the nasal cavity, so here we need to do a balloon catheter rather than just a simple hold pressure type situation. What kind of nystagmus is associated with peripheral vertigo? So peripheral vertigo is more benign. These are issues that are happening with the ossicles of the ear, and this is more horizontal nystagmus with the eyes. If we see vertical or even rotary nystagmus, we're going to think more of a central cause, such as the brain. Which TB medication causes peripheral neuropathy? So this is going to be your isoniazid. I think about little eyes on your fingers and your toes, and that's going to cause peripheral neuropathy. Which TB med can cause orange urine? It's going to be rifampin. What is the normal amount of weight gain in a normal pregnancy? So we're expecting about a 25 to 35 pound weight gain. What is the gold standard to diagnose diverticulitis? We're going to do a CT with IV contrast. How can you tell interstitial fibrosis from asbestosis versus silica apart on a chest x-ray? So these are both subcategories of interstitial fibrosis of the lung. I always think about how asbestos will go down into the lower lobes. This is kind of like, in a tall apartment building, all of the insulation is up high, so the lesion settles low in the lung, versus with silica, which is found in the ground and in the earth, that will actually travel up to the upper lobe. What is going to be your treatment for BV? Bacterial vaginosis. So your treatment is going to be metronidazole. What is going to be the best treatment for pseudo-gout? We're going to do glucocorticoid injections. Remember, pseudo-gout is not the same as gout. It's more calcium associated, and this is more likely to affect the larger joints, knees, wrists, ankles perhaps, versus gout is more the hallux of the big toe. Which neurocognitive disorder has impulsivity, compulsions, and hypoaurality? It's going to be frontotemporal dementia. What medications help decrease the prostate size by blocking the conversion of testosterone? So it's going to be finasteride and dutasteride. They are the 5-alpha reductase inhibitors used for BPH, as well as hair loss. What med will block alpha-1 adrenergic receptors to inhibit bladder smooth muscle contractions? This is going to be your tamsulosin, your Flomax. 0.5 milligrams is what we use to treat BPH. What skin condition is associated with Parkinson's? We might see seborrheic dermatitis with Parkinson's. What is the atopic triad? It's going to be your asthma, your allergic rhinitis, and your atopic dermatitis. What condition has morning stiffness that lasts for 1 hour and improves with movement? This is going to be rheumatoid arthritis. What condition has evening stiffness following activities? And this is going to be more osteoarthritis. What labs do you order for rheumatoid arthritis? We're going to do our RF factor, rheumatoid factor, the anti-CCP, and then our inflammation markers of ESR and CRP. What is a DEXA T-score? So when you do a DEXA scan, it's going to give you a T-score and a Z-score. The T-score compares that person's bone mass to a healthy 30-year-old. What is a DEXA Z-score? So with the Z-score, they're comparing it to someone the same age and the same sex. What T-score indicates osteopenia? It's going to be negative 1.0 to negative 2.5. This is your osteopenia range. And then what T-score will indicate osteoporosis? So anything more negative than 2.5. All right, that is all for now. Don't forget to like and subscribe, and be sure to check out my other videos. Thanks for watching.